Tēnā koutou katoa. Welcome everyone to the next seminar in the Puna Haumaru seminar series. Today I'm delighted to invite Dr. Li Eriksson to talk to us about male-perpetrated intimate partner homicide. Dr. Li Eriksson is a senior lecturer at the School of Criminology and Criminal Justice at Griffith University and a member of the Griffith Criminology Institute. Her research examines developmental and contextual predictors of lethal and non-lethal violence, including the role of adverse childhood experiences, offending history, and substance use. As a lead investigator on the Australian Homicide Project, Li has provided advice on homicide reduction strategies to the UK Home Office. So without any further ado, I will pass over to Li to share her presentation. We will have time for questions at the end of the presentation, so if any occur to you during, please pop them in the chat and I'll be delighted to read them at the end. So thank you, Li. I'll let you take it away.
Thank you so much, Apriel. Kia ora. Hi, everyone. Thank you for that introduction, Apriel. Thank you to Puna Haumaru for hosting me for this webinar, and thank you all for coming. My name is Li Eriksson. I have been researching family violence for the past 15 years, focusing specifically on the precursors of lethal violence within the family. My research has taken me and my colleagues into prisons all over Australia, talking to homicide offenders about themselves, about their offences, and about their victims. And it is these experiences and these data that I wish to share with you today. But before I begin, I would like to acknowledge the traditional custodians of the land upon which I'm dialing in from today, the Yuggera, the Yuggera, Yagara and Turrbal peoples. I acknowledge their stories, their traditions, their living cultures, and I'm committed to building a brighter future together. I would also like to take this opportunity to acknowledge Maori as Tangata Whenua and Treaty of Waitangi partners in Aotearoa. So my talk today focuses on whether intimate partner homicide really does occur out of the blue. What I mean by out of the blue, without warning signs, without any indications of risky behavior or high risk. I think the absolute vast majority of those of you here in the audience today would agree with me that they do not, that there are warning signs. But as a society, we're often provided with the out of the blue framework by the media. Historically, when media reports on violence within the family, it does so using episodic reporting and narratives of victim blaming. And in this type of reporting, it is very common to see men who kill their intimate partners portrayed as these upstanding citizens in their communities without a history of violence, who are amazing husbands, role model dads, as per these articles that you can see here. And this type of portrayal signals to the reader that we couldn't possibly have predicted what happened. If he was such an upstanding citizen, if he was such an amazing hubby, if he was a role model dad, then how could we have known? And this type of media portrayal tells us that we couldn't have because they killed out of the blue. And in my presentation today, I am going to provide you with some empirical findings that go against this narrative. But first, I want to set the scene. In this presentation, I focus on men who kill their female intimate partners. And if we look at homicide statistics, generally speaking, we see that the typical offender is male and the typical victim is male. Roughly, approximately 90% of homicide offenders, broadly speaking, are male, and 80% of homicide victims are male. So homicide is a male-on-male phenomena. But when we start to look at intimate partner homicide specifically, we see a very different pattern. when a partner is killed, it is likely that the offender was male and that the victim was female. So women as victims are significantly overrepresented in intimate partner homicide. The data that I share here on the screen are from the United Nations. They refer to international figures, but the same pattern applies across Australia and New Zealand. In both our countries, the most recent data show that 74% of intimate partner homicide victims are female. And so these data speak to the gendered nature of intimate partner homicide. And that's why in this presentation, I'm focusing on men as offenders and women as victims. So what data do we need? To understand and prevent intimate partner homicide, we need a good, solid evidence base. We're incredibly fortunate here in Australia and in New Zealand as well to have such amazing scholars working in this field, many of whom have joined us in this webinar today. We have a variety of very rich data sources at our disposal. We have official data, for example, here in Australia. We are fortunate to have the National Homicide Monitoring Program, which is run by the Australian Institute of Criminology. They do a fair bit of work on homicide more generally, but also intimate partner homicide more specifically. We have data from family violence death reviews established across Australia, New Zealand, and many other jurisdictions internationally. We have researchers and scholars doing significant consultations with stakeholders and practitioners. We have data from victim survivor voices, so those women who have been victims of an attempted intimate partner homicide. We also have informant voices. So my research team and I recently completed some research drawing on information from informants, often known as proxy victims. So friends and family members of women who've been killed by their intimate partners. And last but not least, research that draws on interviews with perpetrators. And all of these data sources are crucial to understanding and preventing intimate partner homicide. But the data that I will report on today come from perpetrator interviews. And I have a quote here that speaks to the importance of understanding perpetrators. In Australia in 2022, states and territories released the government's 10-year national plan to end violence against women and children. And in some of the stakeholder consultations that were completed prior to the release, one of the messages that really shone through was that in order to be able to prevent intimate partner homicide, we need to understand the behavior of the perpetrators themselves. So one of the stakeholders said, working with perpetrators should be a priority. If we're serious about women's safety, we've got to focus on containing men's violence against women and children. We have to know who we're dealing with. So we need to know who the perpetrators are. If we don't know their characteristics, if we don't know their motives, if we don't know their backgrounds, we cannot effectively prevent intimate partner homicide. In my work and the work of my colleagues, we take a life course perspective in understanding violent behavior. So my research, broadly speaking, examines various aspects of perpetrators' childhood, adolescence, and adulthood leading up to the homicide. Broadly speaking, I look at things like childhood abuse and neglect, substance use, so alcohol and drug use, criminal history, coercive control, contact with services, relationship separation, etc. So I take a life course perspective to understanding intimate partner homicide. Now, the focus for this presentation is going to be three specific areas. I'm going to focus on perpetrators' offending histories leading up to the homicide. I'm going to focus on their substance abuse, so drugs and alcohol, and also their use of non-physical coercive control. And throughout what I present today, you will see very clearly that intimate partner homicides do not occur out of the blue. So the data that I am presenting you with today comes from a large interview study with homicide offenders in Australia. It was a study funded by the Australian Research Council. We contacted the correctional agencies in every state and territory in Australia. We received approval from all of the states and territories to conduct a research. So it was a truly national project. The process was such that we sent out information letters to men and women convicted of murder or manslaughter, explaining the aims of the study, and anyone interested in participating then sent us an expression of interest back. We had 5 interviewers who travelled across Australia. They were travelling to state to prisons to conduct the interviews. We also conducted some of the interviews not in custodial settings, but in community settings. So some of the people that we spoke with were on parole orders out in the community. The interviews were conducted face-to-face. Each interview took approximately 2 hours to complete. They were very comprehensive. And in total, we spoke with over 300 men and women convicted of murder or manslaughter. Today, as I've explained, my focus is on intimate partner homicide. So we narrowed that sample down to the 81 cases in which a person had killed a current or a former intimate partner. Much of my research looks at different types of victim-offender relationships, but for this presentation, I'm focusing on intimate partners. And then the next step was to narrow down by gender. And so we are specifically interested in looking at male on female intimate partner homicide. So our sample here that I'm reporting on today consists of 68 men who had killed a current or former intimate partner. But before I delve into our findings, I want to pause and note that research is a collaborative effort. I have been incredibly fortunate to work with scholars in Australia and internationally and across disciplines throughout this work. And what I present today is drawing on publications from these collaborations. And in particular, I would like to thank the investigators on the research team and the ones who dreamt up the Australian Homicide Project and saw it to fruition, namely Paul Maserole, Richard Wortley, and Holly Johnson. So, in terms of findings, I first focus on the perpetrators' offending histories. So that includes prevalence of different types of offending, how old they were when they first offended, their level of versatility, so whether they are specialized offenders or versatile offenders. And the first finding that I'll present you with today is prevalence rates overall. So we asked these men whether they had engaged in a number of types of offences across their life course. And what the men told us was that 1 in 2, so every half, had previously committed theft and related offences. So stolen something, tried to steal something, taken a car, bought or sold or held stolen goods. So that's 1 in 2 perpetrators with a history of theft. We looked at property damage. So 1 in 3 perpetrators reported that they had ever engaged in property damage. That could be things like graffiti, purposeful damage to property, fire setting. Drug offences, in terms of selling drugs, including marijuana and hard drugs, 1 in 4 perpetrators reported engaging in this type of behaviour. We, of course, asked about intimate partner violence, measured partly through the conflict tactics scale, but also we had a range of other measures as well. And we asked the men whether they had engaged in violence in the relationship with the woman that they killed. So this is against the partner that they had actually killed. And about half of the sample had been physically or sexually abusive towards that partner. We also asked about previous relationships. So you might think, well, half who had engaged in intimate partner violence, that's actually quite low. When we looked at whether they had engaged in intimate partner violence ever, so against any of a current or a former partner, actually 8 in 10 reported violence, physical or sexual violence in a past relationship or towards the person that they killed. When we combine these, we looked at any type of offending. So whether perpetrators reported engaging in any of these types of offending, 9 out of 10 men reported some offending behavior. So these are quite high numbers, and it tells us that past offending behavior is actually quite common among men who kill their female intimate partners. Another aspect of offending histories that is of particular interest to developmental and life course criminologists is the age at which a person begins offending, so the onset of offending. And we know from years of research that if a person who engages in offending behavior earlier in life, the more likely they are to continue down a pathway of chronic and high frequency offending. So in our sample, we saw that 1/3 of the perpetrators had first offended before the age of 13. So they had an early onset of offending. So this is actually quite a high proportion of the sample who started their criminal careers quite early on in life. Another area of interest is how versatile offenders are in their offending behavior. So versatility is juxtaposed with specialization. If you have an offender who only commits a certain type of offense, that offender would be known as a specialist offender. Somebody who engages in a wide variety of offenses would be known as a versatile offender. So we looked across 7 different offending behaviors. So a person could score either a 0 if the homicide was their first ever offense, and a 7 if they engaged in all 7 types of offense categories prior to the homicide. And we saw that perpetrators on average had engaged in 2.8 types of offenses. And it might not seem like a very high number, but it does tell us that men who kill their intimate partners have a relatively versatile offending history. The next area that I want to cover is substance abuse. We're going to focus on the perpetrators' self-reported problems with drugs and alcohol in the year leading up to the homicide. So to measure substance abuse, we used established screening tools that are frequently used within clinical settings. I'm sure many of you attending this webinar today have used these tools before. So we used the 10-item audit, the alcohol use disorder identification test, and we used the established guidelines to divide the sample into those who had no or low level alcohol problems, medium level alcohol problems, and high level alcohol problems. And what we see, so this is self-report data, self-reported alcohol problems in the year prior, so in the year leading up to the homicide. Of all the men who killed a female current or former intimate partner, a bit over half had no or low level of problems with alcohol. And at face value, this might seem like a significant proportion that don't have or didn't have any problems. But it does leave us with about 1/4 of the sample who had medium level problems according to audit, and about 1/5 who had high level alcohol problems according to audit. And if we compare our data with general population data, we see that a much higher proportion of the men in our sample had alcohol problems compared with the general population. So we're looking at roughly twice the prevalence rate. So in general population samples, less than 23% fall into these 2 categories, so either medium or high level. But in our sample, 25 plus 21, 46% fall into these categories. And it becomes even more pronounced when we look at the highest or the most problematic category. We see that about 4 times the prevalence of high level of problems in our sample of intimate partner homicide perpetrators compared with the general population. Just out of interest, we also have some questions relating to their use of the substances at the time of the homicide. And we published a couple of papers looking specifically at this. In this sample, we see that of men who had killed their intimate partner, almost half had been consuming alcohol immediately prior to committing the homicide. So this is at the time of the homicide. Turning now to drug abuse, we use the 10-item DAST, which is, again, is a clinical screening tool. And we used the established guidelines to divide the sample into 5 categories, ranging from no problems with drugs to severe level problems with drugs. Again, we see that the majority in our sample self-reported that they did not display any problems with drugs in the year leading up to the homicide. However, comparisons with the general population data show that the prevalence rate of problems in our sample was much higher than what we see in the general population. So in the general population, less than 10% have moderate, substantial, or severe level of problems compared to a much, much higher prevalence rate in our sample. In terms of at the time of the homicide, we see that about a quarter had used drugs immediately prior to committing the homicide. So that was substance use. We've reviewed the offending histories of men who kill their intimate partners. We reviewed their substance abuse problems, turning now to non-physical coercive control. And this is important to understand. It's, of course, very topical, but it's important to understand because sometimes victims and their families do not recognize these types of behaviors as domestic and family violence. But we know that from the literature that non-physical coercive control commonly precedes intimate partner homicide. Now, it's important to remember when we're talking about coercive control, it's important to remember that acts that are intended to control a partner are highly individual and specific to the context of the victim and the relationship. Coercive control is made possible because of social and structural gender inequalities present in society. But the aim of coercive control, drawing on Stark's work, is really to reduce and restrict someone's liberty and someone's autonomy. Given that coercive control depends on the context, it can be physical, it can be non-physical, it can be displayed very differently across different relationships. It's important to point out that we do not have a perfect measure of coercive control in our study, but what we do have are a number of proxy measures. These are behaviors that are commonly seen in relationships characterized by coercive control. So the ones that I'm going to present to you today are psychological abuse, entitlement and proprietariness, so the extent to which a perpetrator feels sort of a sense of entitlement and ownership over the victim, as well as sexual jealousy. So turning first to psychological abuse, we see that 2/3 of the sample had engaged in some form of psychological abuse towards the victim leading up to the homicide. So this is an ever prevalence measure. So anytime during their relationship. So 2/3 had engaged in psychological abuse. And these are things like, giving you some items here as examples, insulting or swearing at the partner, calling her names such as fat or ugly, shouting, yelling, destroying property and things like that. So 63% of men who had killed their intimate partner reported having been psychologically abusive towards that victim previously. We look at entitlement and proprietariness. We used a scale, a 28-item scale by Haumaru and colleagues. So what is entitlement? What's proprietariness? It's this belief that your partner is your possession, is your property. You have a right. You're entitled to control your partner. What we did was we dichotomized each item And if a respondent agreed with at least one item, he was considered to exhibit entitlement attitudes. And what we can see here is that 44%, so about 4 in 10 perpetrators, agreed with one or more statements. Again, I've given you some examples there of the questions. So there are 28 questions in this scale, but some examples include having the right to contact my partner's friends to see how they act without me around, looking through their drawer and handbag, and this sense of entitlement in terms of if my partner leaves, I'm going to make sure that she regrets it. We also looked at sexual jealousy. This was a set of questions that asked respondents about hypothetical scenarios and how upset they would be if their partner was, for example, flirting with or somebody else was flirting with their partner, how upset you would be if your partner talked about an old lover. For this scale, we actually have quite a high bar set here. We quoted someone as exhibiting sexual jealousy if they answered that they felt very upset to 2 or more items on this 8-item scale, which is quite conservative. But as you can see, 1 in 4 exhibited this really kind of high level of sexual jealousy according to these criteria. We also asked the perpetrators if they had any suspicions in their mind, whether real or not, that their partner was cheating on them in the year preceding the homicide. And as many as 45% said that they thought their partner was cheating on them sometime in that year. We asked about separation, giving that separation is a key risk factor. And in half of the cases, the man had killed an ex-partner. So they were actually separated at the time of her killing. Now, given separation is such a key risk factor, we see separation listed over and over again in research, in death reviews, etc. I want to provide you with some illustrative quotes from the men about their perceptions of the separation. Here, for example, is one man who describes feelings of rejection, feelings of humiliation, because his partner had separated and then gotten together with a new man, and him just not being able to cope with the idea of her leaving him. So he said, I felt jealous, rejected, humiliated because she had asked me to leave, got a new boyfriend, and I wasn't over her. Similarly here, another illustrative quote, we have a man who quite vividly describes his feelings. He says that he contracted when he found out that she was leaving him. He says, I contracted, I was very emotional, it broke me, my whole world just crashed. My whole world went dark. I felt invested in the relationship. So there is this sense of, without her, I am nothing. I have invested so much in this relationship that I am nothing without it. Another one here, these feelings are particularly palpable in this quote here. This man says, without her, I was alone. She was my life. My spare time was her time. So his whole life, his whole identity was her. He had no sense of self outside of this relationship. Here is another one, and this is the last quote, I promise, who illustrates this quite well. He says, I was so enmeshed in the relationship, I didn't understand the concept of own space. So I think from these illustrative quotes, it is clear that these men's sense of self were intertwined with that of their partners. There is possessiveness, there is jealousy, coupled with anger about separation, coupled with fear of abandonment, and this constant need for reassurance and an excessive dependence on the relationship. And for those of you in the audience who are in the area of psychology and related fields, this, for obvious reasons, led us down the path of attachment. So we also asked the men about their romantic attachment styles. We had a measure of romantic attachment from Brennan and colleagues. And based on general population data, we would expect that, apologies. We would expect that secure attachment would be in the majority, right? If we base our understanding on general population data. What we see here, however, in this data set is that the vast majority of men who kill their intimate partner actually displayed an insecure romantic attachment style. Only about 1 in 3 exhibited a secure attachment style, according to this measure. 1/4 instead had a fearful attachment style, so this kind of negative view of themselves and of other people as well. So having this kind of high level of anxiety, high level of avoidance as well, which often results in this kind of push-pull type of behavior. 1/4 had a preoccupied attachment style, so being quite clingy, afraid of abandonment, and the least common was dismissing. Very few had this sort of detachment or detached, I should say, avoidance style of romantic attachment where they prefer their own autonomy and are not particularly anxious about their partner leaving. So that was in the minority. So I've presented you with a lot of data today. What does it all mean? What are the implications of all of this? So the question I posed at the beginning of the presentation was whether intimate partner homicides really do occur out of the blue. And I think based on the information that I provided you with today, the answer to that question is a resounding no. Interviews that we conducted with men who had killed an intimate partner reveals that offending behavior is actually quite common sometime across the life course. If you recall, 9 out of 10 had engaged in some sort of offending across the life course. The interviews also revealed that men who had killed an intimate partner had really quite high prevalence rates of substance use problems, much, much higher than the general population. And we did see high levels of non-physical coercive control as well as insecure attachment. And these findings challenge the perception that we often see in the media or portrayed by the media that intimate partner homicides occur out of the blue. And based on these findings, I want to emphasize the opportunities available for intervention across 2 areas in particular. First, assessment of risk of individuals who come into contact with the criminal justice system, but also the role that the primary health care sector plays in identifying and responding to domestic violence. So talking first about risk assessment, there's a range of risk assessments across Australia and New Zealand and across the world, and many scholars have called for a more consistent approach across jurisdictions. Just in Australia, for example, different states and territories use different types of different methods of measuring risk, different types of risk assessment tools. Many of them have been empirically evaluated, and that's great, but we need to ensure consistency across jurisdictions. There is, of course, consistency, especially as it relates to some of the more common risk factors, for example, a history of domestic violence, as well as misuse of drugs and excessive alcohol consumption, which is something that we looked at particularly in this presentation. That's also commonly included in risk assessments, although it's not included in some tools. And of course, indicators of coercive control, jealousy, controlling finances, and that kind of stuff. What is interesting, though, is that other forms of offending behavior, such as those that I presented here today, drug offences, for example, are often not included in risk assessments. But what our data tell us is that these perpetrators are not your average Joes. Many of them actually have extensive and often quite versatile offending histories. It's also important to remember, of course, that risk is dynamic. A low-risk case could escalate quite quickly to a high-risk case if there is a change in circumstances. And we need a risk framework that is flexible and adaptable enough to be able to work with such changes. Importantly, however, in Australia and in many other jurisdictions as well, very few risk assessments are focused on assessing risk of lethal violence. Most risk assessments predict recidivism or reassault. And there is some really important work that needs to be done in this field around understanding the risk factors that might be unique to lethal forms of intimate partner violence as opposed to non-lethal forms of intimate partner violence. I did some interesting work with my colleagues and I with Queensland Corrective Services, for example, and we looked at these differences, and there were differences that emerged that actually showed different or unique risk factors for lethal intimate partner violence. What about considerations for primary healthcare? Our data show that a relatively high proportion of intimate partner homicide offenders have problems with substance use. And general practitioners, for example, are well placed in identifying and assisting people who drink excessively or perhaps develop problems as a result of drug use. And in these consultations about their problematic behavior lies the opportunity to identify problematic behaviors across other areas of their lives, including domestic and family violence. There's been a lot of excellent work done in terms of overcoming the barriers to disclosure and inquiry of domestic violence for women who attend primary care, but less work has been done around primary healthcare providers' ability and readiness to identify perpetrators and to respond to potential disclosures of problematic behaviors. And it's important also, I think, to understand that we need education, right? Research shows that perpetrators of violence are very likely to minimize their behavior. And this means that identification and assessment of intimate partner violence in primary healthcare settings require careful and sensitive questioning and application of clinical judgment as well. Now, it's important to remember that there are limits to what can be achieved in a GP clinic or a substance use facility. Staff need to be trained and supported in responding to domestic violence. Cross-sectional partnerships need to be strengthened to allow for collaboration across agencies. And also there are structural barriers in place. Time is one of those things. The time that you have with a patient is very, very limited. So there are barriers to primary healthcare providers' ability to identify and work with perpetrators. That said, there are some great educational tools available aimed at enhancing primary healthcare providers with the tools to address family violence. This is just one example of many, many programs that are really excellent in what they do. This is the Safer Families Centre led by Professors Hegarty, Brown and Humphreys. And part of that program focuses specifically on identifying patients. So this is in primary healthcare settings who might be perpetrating domestic violence. So how do you start that conversation? How do you support behavioral change? And just a few months ago, for example, I attended one of their online workshops focusing on how GPs can engage with patients who use domestic violence. So there's some excellent work being done in this field. That is all for me. Thank you very much for attending and for listening.